Is it most of the time fatal?
Yep, my name is Dr. Aly Cohen. I'm a veterinarian at Cornell University. I specifically work in the shelter medicine department there, along with working at the Rhiney Canine Health Center.
Well, thank you so much, Dr. Cohen. We're really excited to have you here on the first episode of the Mighty Pet Project. As I was saying, I did see a little video about bloat, and I'm not talking about when I eat a lot, but in dogs, I heard that it can be very serious, and most of the time fatal if nothing is done in time. So can you tell me a little bit about bloat and how can we prevent it and or what to look out for?
Yeah, you're right. That bloat is definitely something that can be a life-threatening condition. There's two distinctions to make. So when we talk about bloat, we are actually talking about two different things. So there's one bloat, which is where the stomach can distend kind of suddenly, and that will either be with fluid, air, or food, and it just becomes rapidly distended. But what makes it life-threatening is when it can actually, the stomach will twist on itself, and
Oh,
that basically cuts off all the circulation to the abdomen, and that's what will cause kind of like this life-threatening crisis. So we see it more commonly in these large, deep-chested dog breeds, but there's also some breeds where they're just a little bit more susceptible too. Like I don't think people automatically think about poodles, but they usually think about Great Danes, which both are at risk. So it's important to know what your breed, or even if you have a mixed breed, kind of if they have that confirmation of this large, deep chestedness to them. So the most common sign to look for, we call it this non-productive retching, which essentially looks like your dog maybe is like trying to throw up, but nothing is really
oh
coming up. So they just kind of like retching, hacking, but nothing is
oh my
coming up from it. So
God. Okay.
the other thing to think with it, because yeah, sometimes your dog maybe it'll just do a little hack, and the thing that will match it with is they'll often be really restless. They may start just
Mhm.
pacing. Their abdomen might actually look bloated, or they'll feel very tender and almost painful on their abdomen, and often they're drooling a lot along with it. So
Oh.
all of those signs together would be a big concern, and when in doubt, you're better off taking them to the veterinarian to have them evaluated than to risk waiting.
Is it most of the time fatal? Like if not treated immediately?
Yeah, blow if the stomach has twisted on itself, it often will be fatal without treatment, and you'll see them start to decline even more. Like if you're on the fence and you wait, they're going to become more and more lethargic. They're going to be eventually be laying down, unable to move, and that will progressively lead to them dying from this condition. So the earlier you respond, the better chance of them surviving medical and surgical treatment.
Yeah. But some people think I'm crazy because I'm a helicopter mom and I'm like, Dash is breathing a little weird. That does not look right. But I think it's so important for pet parents to really know what's normal, what's not normal when it comes to their own pet and understanding some of the little body language that they might be giving you because again, they can't tell you what's wrong. So that's why it's so important to always monitor your dogs, regardless if they're just resting or being active. I think in a split second, everything can go wrong.
I
But
think that's a great way to
yeah.
put it because you do know your dog best. And so having that sense of what's normal and what's not normal for your pet is so important for you being their advocate. So I think that's a great way of phrasing it.
Yeah. What can we do to prevent bloat? I heard that kind of limiting their water after they play, or even not letting them play after dinner, which is it's a problem for Dash because right after dinner he loves playing, like he does his digging, he wants to throw the toy. But after I learned about bloat, I keep telling him, no, bud, you gotta wait at least an hour.
Yeah, so I will say some of the evidence around like exactly how to prevent is not 100% known. The best way to prevent it, especially if you have an at-risk breed, which I wouldn't necessarily say like corgis are the number one at-risk breed, but it can happen to a breed of any size. Um, but the best way to prevent it, if you know you have an at-risk breed, is a prophylactic gastropexy, which is actually a surgery to have done when your pet is very healthy. It's often timed, at the time that they get either spayed or neutered, where they actually tack a piece of the stomach to the side of the body wall to prevent
Oh,
it from twisting on itself. So if you have one of those breeds, it's definitely something to think about having done. It won't prevent the bloat portion. So technically the stump, like if your dog got into its whole bag of food and it just ate tons and tons of food. Not that I have seen this happen before, but yes, it happens. It could get a bloat where the stomach is very, very full, but it would prevent it from twisting
twisting.
because it's attached to the body.
So the
So
twisting is what actually makes it fatal.
correct. Yeah. Now, if their stomach is bloated and enlarged, that is very painful and uncomfortable. And, they may sometimes have issues with that. That could be serious, that involve monitoring and things like that. But the real life-threatening component, yes, is the twist. So that's called GDV. Gastric dilatation and volvulus is the medical term. So gastric dilatation is the bloat, just means that the stomach is dilated, and the volvulus is the twist.
That was a mouthful of
It
a.
is. That's why people usually call it bloat,
Yeah.
but GDV is like a common term you may hear, or something you may hear, when researching online. GDV is kind of like that medical term that describes the twist.
Now, let's say that someone might not even know about the surgery or might not have a breed that is prone to bloat and the stomach twisting. Any other tips that they may follow at home to kind of just prevent it?
Yeah, I think things that we can do, especially to decrease just like this huge influx of food or water, would be, breaking up meals in the day. It surprises me, but I still see people that are like, my dog only wants to eat once a day, and maybe that works for their dog. But ideally, if we're looking to prevent bloat risks, having at least two or more, but usually two is the easiest for people, meals throughout the day. We actually recommend avoiding the raised food bowls.
Oh,
Um,
really? Of
yeah, and I
why
think a
is
lot of
that?
people think with the big dogs, they want to have the raised food bowls, and there's been, some people looking into that's actually can worsen it. And then limiting activity after meals, like you mentioned before. A lot of these other things, they're not slam dunks. Genetics has a lot to do with it, and so if you have a pet that you maybe got from a breeder, it's always good to ask if there's a known history of any of their relatives that have had a bloat or GDV, because that can give you useful information for your dog's risk. Now, of course, if you have like a mixed breed, you got it from a shelter, you're not going to know all that. And so that's where kind of taking the whole picture in in review is important.
So thank you so much, Dr. Aly Cohen. It was such a pleasure talking to you, and thank you for participating in the Mighty Pet Project in our mission to keep pets healthy and live longer. Thank
You're
you.
so welcome. Thank you for having me.